272 cases, and Migori, also at the border, comes in 7th with 215 cases. Those are the high number cases counties. Other counties are Nakuru 195, Uasin Gishu 166, Kilifi 95, Makueni 72, Kwale 56, Taita Taveta 43, Kisumu 41, Garissa 36, and so on. We go downwards in descending order until Elgeyo Marakwet that has 1 case. These details are in the report. You will be able to get that. Ladies and gentlemen, these figures should worry anyone who cares about our country, and that it is not business as usual. This situation should jolt us into action and ensure that we strictly adhere to the containment measures spelled out to curtail the further spread of the virus. However, it seems that this message has not sunk very well among our people. In the past few days, we have continued. I'm saddened that particularly here in Nairobi, where the numbers are growing in their hundreds every day, a lot of people do not seem to care and have thrown all caution to the wind. We are aware that some people are not taking this disease seriously, and some do not even believe in the figures given by the government. This is not true, my friends. Let us not behave like doubting Thomases, waiting until we are directly affected or one of our family members is infected for us to act. That is why we shall not tire to perform our duty of reminding you that we must strictly adhere to the containment measures of washing our hands with soap and running water, maintaining social and physical distance, wearing face masks in public places at all times, and avoiding all forms of gathering. The country has also relaxed the secession movements, as well as allowed some level of worship to occur. We have observed that in some parts of the country, even as people go for funerals and maybe even comply with the protocols that we have placed for funerals, that there are also incidences where at some of these funerals, people gather together to eat. Those are the perfect environments for the spread of the virus. And we want to say to Kenyans, we want to discourage that kind of behavior. Let us not for a moment forget what this physical and social distancing means. We must be aware of that at all times and maintain those distances, because that is the way the virus spreads. And I want to reiterate that before any cure is discovered for the virus, these are our only weapons to fight it at the moment. And if we must save our country from the pandemic, we have no other option but to strictly follow these measures that have been put in place. The other point that I want to stress today is that COVID-19 does not make any distinction on who it will infect. As our CS has said, you can get it, I can get it, anyone can get it. There is no reason, therefore, to treat this disease and stigmatize it. We have over 5,000 people who have contracted, turned out positive, and have recovered and are going around their lives as they have just overcome any other disease or a flu. And so there is no reason for us to stigmatize this disease. When it appears that the stigmatization of this disease is going really to hamper the efforts to try to contain this disease. Let's not stigmatize this disease. If today you are told your colleague is positive, it doesn't mean you now, keep him at 10-foot pole away from yourself, or you don't even want to appear anywhere near him or near people associated with him or her. Let's not stigmatize the disease, while at the same time we observe those measures that will protect us. Fellow Kenyans, turning to our COVID-19 situation in the country today, we have 418 people who have tested positive for the disease after testing a sample of 2,474 over the past 24 hours. This now brings to 13,771 our number of confirmed cases in the country, and the number of cumulative tests that we have performed so far stand at 246,361. These 418 confirmed cases, 408 of them are Kenyans, while 10 are foreigners. 263 are males, 155 are females, a pattern that we have seen repeatedly. Again, the youngest this time around is a 1-year-old infant, and the oldest is 86. So, being infected does not respect age either. The 418 cases are distributed in the counties as follows: Nairobi, 292, Kiambu, 54, Machakos, 28, Kajiado, 13, Mombasa, 6, Nakuru, 5, Narok, 5, Meru, 5, Kitui, 3, Nyandarua, 2, Nyeri, 2, Busia, Garissa, and Isiolo, 1 each. In Nairobi, we have several sub-counties that have been affected. The 292 cases from Nairobi come from Starehe, 31, Langata, 27, Kibra, 23, Westlands, 21, Makadara, 20, Roysambu, 19, Embakasi East, 18, Dagoretti North, 17, Embakasi West, 16, Dagoretti South, 15, Embakasi South, 15, Kasarani, 14, Embakasi Central, 13, Mathare, 12, Embakasi North, 11, Ruaraka, 11, and Kamkunji, 9. In Kiambu, the 54 cases are from 7 sub-counties, and I will not list them, but they are available on this document. In Machakos, 28 cases come from Machakos Town, 17, Athi River, 9, Kathiani and Matungulu, 1 each. Kajiado has 13 cases, as I said earlier on. Mombasa, we picked only 6 cases this time around. Nakuru's 5 cases come from Nakuru East. And in Narok, the 5 cases are in Nakuru South. You will find in the document further information on the sub-counties that have been affected. Today, I'm delighted to inform you that 494 patients have been discharged. Out of this number, 465 are from the home-based care, program, while 29 have been discharged from various hospitals, bringing the total number of recoveries to 5,616. And I want to take this opportunity once again to thank our healthcare workers for this great achievement that we have been witnessing. On a side note, we have lost 19 patients to coronavirus over the past 24 hours. This, as you will see, is the highest number of deaths we have recorded in a single day since the pandemic struck. And it brings our number of fatalities due to the death to now 238. I want to pass our sincere condolences to the family and friends of those who have lost their loved ones, now and before. Finally, I would like to appeal to our people, now that the movement restrictions have been lifted and our places of worship have been reopened, to exercise individual responsibility in this fight against the disease. It is time for everyone to be your brother and your sister's keeper. You saved my life and I save yours. And I think if we continue being responsible, adhering to the measures put in place, recognizing the dangers of spread of this pandemic, I think we have a good chance of being able to put down the spread of this virus. Thank you.
Hi, my name is Graham Kajila from The Standard. My question is with regards to the predictions that were made. Because the other time the DG said that at the peak we expect like 200 cases in a day. We've been recording more than 200 cases in a day. So I would like to understand how do you come up with the peak? For example, because you understand the more we test, the more people we get. So is that the model that you use, or are you using the number of infections, or using the number of deaths to determine the peak? When will this peak be exactly? And probably you could give us the new models that you have on what numbers you expect probably in the next September or something.
My name is Anita from NTV. Following NTV's expose last night showing that bars are clearly still running past curfew hours, what action are you taking against these bars? Additionally, if there are any bars that are being closed, how many are there? And could you kindly elaborate on herd immunity, how that works, and whether when someone recovers from COVID, whether the antibodies, how long they last? Do they last a month, or how long do they last? We've seen a couple of studies, and we'd just like some clarification on it.
Good afternoon. I'm Purity Museo from KBC. My first question, how many health workers have tested positive so far? I do understand there was some testing going on at Pumwani Maternity Hospital. And then number two, are hospitals admitting COVID patients, because most of them are under the home-based care program, and what the capacity in the country right now?
Nasibo Kabale from Daily Nation. In the last 5 days, we've seen a surge in recoveries, especially for home-based care. My question is, first of all, are we seeing any deaths from home-based care? Any deaths? And then the second one, what do we attribute to this success in home-based care? Is it that people are now more conversed to, treat ourselves at home than in hospitals?
Okay, thank you. Let me start by responding to Kajilu's question about the modeling and the predictions. As you noted, we had earlier said that 200 deaths during the peak time. That's true. And that depended upon the model that was used at that time and the inputs into that model. I think we have elaborated here severally that initially, when this whole thing began, we did not have any data that we could feed into the system. And therefore, a lot of the data and assumptions that were made were borrowed from elsewhere, which is why those predictions never really held, because there was no solid data from the country itself. In the last 3 or 4 months that we have now been fighting this pandemic, we have generated quite a bit of data. And the type of data that goes into modeling is very complex. There are a number of types of data that are taken into consideration, not only the numbers of people who are positive or even the number of people who die, but the impact of some of these measures that are put in place. They need to be somehow be quantified and be entered into that model to be able to give you the right predictions. So models will change with time depending upon the data that is created, that is generated as we move on. And we now have models of predictions that are done on a regular basis. If I recall the last one that we are looking at, which is a composite model that takes in different things, both the epidemiological parameters as well as some of the containment measures to determine what is called the RO of the virus, or the reproductive number. And we still are informed that our peak is likely to come in probably late August, early September. That is the working hypothesis that we have now, is that around that time. But this is likely to change as we move on and see what is happening in the country. This information is continuously being fed into the model to adjust it as we move on. So maybe we will see now with this rise of numbers. I know that we have seen 700, 600, 500, 400 numbers per day over the last two weeks or so. We will look at that and task the team to see what the predictions tell us. But they still feel that that is the time that we should be arriving at our peak, around that time. Then, so that answers your questions, Kajilu. NTV, why are bars still operating, and what is being done operating after curfew hours? Yes, we have, it has come to our attention that there are a number of, I will call them establishments, that are operating as bars, and some of them, as we have read in the papers, even operating way beyond curfew hours. What we know is that some of these establishments are actually restaurants that have somehow gone or converted themselves into bars using that license of operating as a restaurant. I think the regulations and that were put in place regarding this, it's still, bars have not been allowed to reopen. Bars and pubs have not been allowed to reopen. Unfortunately, some establishments that are eateries are also doing some bar business, and this is being looked into. As you know very well, we have the various arms of government that implement some of these regulations that we put in place. I'm sure that this is being looked at. Then you asked about herd immunity. What herd immunity means? Herd immunity means when an infectious disease strikes a population, it generally will, unless serious measures are taken depending upon the nature of the disease, it will most likely infect many people And in the process of infecting many people, people will develop a level of immunity to that disease. Okay. The initial people who may be infected by this disease may bear the brunt of that disease, but over time, most people who will be infected will develop a level of resistance, and that is called herd resistance. Herd resistance has been seen in a number of infectious diseases and the way they spread. If you recall, some countries initially felt that perhaps they should leave things to just be as is without putting any measures, in the hope that herd immunity would prevail at some point. But after seeing the veracity of this virus in terms of its spread, the speed and ease with which it spreads, I think they had to withdraw and put in some measures because that's necessary. So whether herd immunity will develop against this virus is something that awaits to be seen. We don't know. In fact, even with those who have been infected, we are not certain this immunity that they get, how strong it is. There is work going on to determine how strong is this immunity. Are there neutralizing antibodies that are generated? It seems yes, there are neutralizing antibodies. How long do they last? Studies right now are not conclusive, but it appears that this immunity, as of now with the studies that are done, may not be long lasting, that it may taper off. The question then is, can somebody be reinfected? Again, that is a question that is out there. Once this data comes out, we shall know. And you understand that without that knowledge, then it becomes very difficult to determine really what the best strategy to contain this virus is, other than containing its spread. Purity, you asked about how many healthcare workers have so far tested positive. I think the last glimpse I had on the numbers, we are looking at about 526 that have turned positive. 526. Are hospitals admitting COVID-19 cases? Yes, hospitals are admitting COVID-19 cases. One of the reasons of establishing the home-based care was really to be able to free hospital beds for those who need hospitalization, and not those who are asymptomatic and just need to be contained somewhere, as we were doing before, but put those ones under home-based care so that you have enough facilities to be able to take in COVID-19 cases. And you know that very well. One of the actions that is being undertaken by all the counties is to establish a 300-bed capacity for every county. And that is to be prepared to take in patients if the numbers rise and there is a need for people to be taken in into a hospital for clinical management. That clinical management, of course, is a spectrum. There are those who will be moderately ill and who will probably be managed and in due time recover. There will be those who may be severely ill, who might also recover or who might progress on, and there will be others that will be critically ill that will require critical care and support, oxygen support or even ventilation support. So amongst those facilities that we are being set up that have this number of beds to accept these patients, there will also be a certain number of beds that should be able to cater for those who are severely ill and need support. Nasibo, home-based care, we are seeing a success story in the sense that we are able to discharge people from home care. As you know, home care is based again on the nature of the case that is confirmed COVID positive. To qualify for home care, number one, you must be asymptomatic. In other words, you're positive by test, but you do not show any other signs. Two, there are a lot of other provisions that you must meet, including, where you're going to be kept, how you are kept there, who takes care of you, the room that you are in, how well ventilated it is, and many other things. But that is really the way to go, and by going that way, we will be able to minimize the use of resources. We will be able to ensure that people are taken care of within their home settings. And remember that part of recovery is also psychological. Psychological in the sense that if you are in the comfort of your home, we don't know what contribution that comfort makes, but I'm certain that it has a huge influence upon how people recover. Whether there are any deaths from home-based care so far, I would imagine we don't, but Dr. Kuria might expound on this. I would imagine we don't, because of the simple reason that home-based care doesn't mean that we put somebody in a home-based care and then they are forgotten there. These individuals are monitored through the system of healthcare workers that we have, particularly the community health volunteers who have been trained and who work with communities, who keep an eye on them. And the idea is that as long as the individual does not show any clinical signs of disease or progression to disease, they are well and fine in the home setting. But the moment they begin to show any sign of clinical progression, they are removed from that home and taken to a facility. So I think by the time a death occurs, this process should have taken place. But I will allow Dr. Kuria maybe to talk a little bit about that. I think that addresses the questions that were directed at me. Dr. Kuria.
Thank you, Pastor Rashid. The response was satisfactory, sir. Because the whole essence of home-based care was, as you said, Waziri, is that those who are largely asymptomatic are managed in settings that are comfortable in, and more so close to their relatives who provide for most of their basic needs. And being largely asymptomatic, some will be pre-symptomatic. And the essence, therefore, of home-based care is that we continue monitoring them, and any who develops symptoms in the course of the follow-up is admitted into healthcare facilities. We have not recorded any deaths, therefore, so far from our home-based care protocols. But we must caution here that, on the other hand, there are a number of community-based deaths, most who are not yet confirmed as positive, but upon testing are becoming positive. So these are to be differentiated from those passing on from the home-based care management. So far, not yet, but we will continue monitoring this, because it's a way of monitoring the success of these home-based care protocols. Maybe to expand slightly on the issue of bars. That is an issue that is disheartening all of us, that the more cases we are reporting of COVID-19, the more we are seeing Kenyans taking to the bars, and some very late in the evenings. I thought the guidelines were very clear that where bars remain closed, and in his address to the nation on 6th July, the President insisted that the bars are to remain closed. So what we are seeing opened are not bars, but those that we authorized to open as restaurants and eateries, that, as Waziri has said, have converted themselves into bars and serving beers up to 4 a.m. under against curfew times. I do remember that in his directive, in his speech also, he directed that even these eateries, beer shall be served on a takeaway basis. So anyone who is serving a beer in a sitting arrangement is contravening the presidential directive. So only stern action can be taken against such. And the ministry, with the conjunction with other relevant authorities, are working on this. And as the CS said, some may have to be closed, but not just closed. I think there is a legal notice in the process, and punitive action will be taken against it, not just closing the restaurants, because it is disheartening. And the behavior of some of them, if you walk across, is even more disheartening. The behavior in these bars at 1 a.m. is deplorable. All those things that you have talked about, social distancing and contact, are the very opposite what people are doing. Masks are thrown off, and all manner of human behavior is back in the restaurants. It's deplorable. As I always say, Kenyans are Kenyans, but it will teach us a lesson, I guess. Thank you, sir.
Thank you.
Thank you so much. My name is Enoch Sikolia. Probably before I ask my question, I just noted something. You said the total fatalities 238, and yet yesterday the total fatalities were 234. Is it an oversight or something? My question, when we are talking about 19 deaths, it's the highest the country has reported. So did all of the fatalities have an underlying condition or something? Where did they die? Was it in hospital? Were they hospitalized when they met their death? Then there's something that I would love to understand about when you talk about the issue of certificate, when you're given the COVID-19 certificate. I would love to understand what the essence, the importance, because you're given a period of 14 days. And there's some people when they're given that certificate, probably, let's say, and I use an example of a truck driver moves from Mombasa before he reaches, let's say, the border point of Malaba. He has interacted with so many people within a period of 2 days. So probably he still has a negative, a certificate that shows that he's negative, but he has interacted with a positive person and probably got infected. And then he continues moving in the opposite direction and still interacting with so many. It's happening in Busia, it's happening in Malaba border point. So what is the rationale of giving someone this certificate? And after that, is it just about enabling people to move, attend functions, or does it give someone some sense of security? And then the last question, probably, that I would love to know is, you've talked about people going to bars, people going to, but we've seen leaders going about the activities in total disregard of the guidelines that are given by the Ministry of Health. And some, we have seen even Kenyans complaining on social media that probably there is some sense of discrimination when handling this issue. And we know very well that people learn what their leaders are doing. We have seen leaders dancing in close distance, some of them not having masks, and these video clips moving around on social media. Then it gives Kenyans this sense that probably the government is not telling us the truth. So at what particular point are you going to take a stern action against leaders who are floating these regulations?
Thank you very much. My name is Emmanuel Toh from KTN News. My first question has been addressed about the deaths. So the other question is, there were reports that 2 CSs and a senior government official tested positive for COVID-19. What is the position of the government on this? Thank you.
My name is Mwangi Maina from TV47. After the relaxation of the cessation of movement, we have seen Kiambu coming second in reporting cases on a daily basis as compared to Mombasa. What is the secret with Mombasa? They are recording low numbers on a daily basis as compared to Kiambu, bearing in mind that even before the relaxation of the cessation, Kiambu was still in close proximity to Nairobi. And then my second question is, what is the correlation between diabetes and coronavirus? Because we have seen that the more people who have succumbed, most of them, the underlying condition is diabetes. Thank you.
Okay, thank you. Inoxicolia, the number of deaths, I am being corrected here, and I'm told that the cumulative deaths is actually 253 and not 238. So that's a typo error. And in terms of the validity of the test certificate, why is it kept at a 14-day period? The reason that this validity is 14-day period is from the epidemiology of the virus and how once somebody gets it, the course that it goes through, and how it multiplies within the body. The virus has a short incubation period. Once you are infected by it, unless you are asymptomatic, then you will begin to develop symptoms between 5 to 7 days. You develop the symptoms, the clear symptoms that are consistent with COVID-19. And the virus will continue to multiply within the body, but at some point it will begin to taper off. The actual virus that one may be shedding, and we can look at it in terms of shedding because it is mostly a respiratory virus, so it will be shed through coughs, through sneezing, and through the nose. And that is why we sample those points, because that is where it really is most of the time. If you follow that, you will find that within 14 days or so, you cannot be able, in most cases, detect the virus in individuals who had been infected. So generally the course is 14 days in most cases. Of course, there are differences. There are some people who continue to harbor the virus and shed it for longer periods of time, but those are exceptions. Generally, most cases, by 14 days, the virus is not there. Absence of virus in this case means you don't have the disease. Remember, our testing is based on presence of virus, not presence of antibody to the virus. That's why we do the molecular test, to actually look for presence of virus. So absence of virus also means that you don't have the disease anymore. You cannot transmit it because you're not shedding it and it's not there. It may be even if it is there, it may be in very small numbers that you cannot detect and that are not sufficient to cause any problem. But generally, if it's a negative test, it means you're free to go. So the question then is, that is the reason why the certificate lasts for 14 days. 14 days. So if somebody is negative and they go through this process, there is a chance, you are right, that somebody could contract it, remain asymptomatic, and be spreading it until the 14-day period. That's the danger that we are careful of, because somebody else who contracts it but becomes symptomatic will go seek for help, medical help, and he will be tested and he will be isolated and treated. But the asymptomatic person doesn't even know he has it. And that is the danger. But remember, these truck drivers that we are saying, and that's the reason why we said they must be tested at least 24 to 48 hours before they leave on their journey. We know that if they are holding a certificate and they are leaving Nairobi or Mombasa, within a day or two they are at the border. They should be able to cross over being free of that virus within that time. Okay? And that is why the validity of that is very important, that you must have done that test very, very close to the time that you are embarking on a journey. And you find the same thing with airlines now. Most airlines that are now traveling require also a COVID certificate from passengers boarding that. There is a time limit within which that certificate must have been issued, because that's important. It tells you the time that, it calibrates the time within which that person can travel. safely without any real chance of being able to transmit. If a flight is 8 hours, you can be almost confident that if a person was negative for 24 hours ago, that he will still be okay doing that. Remember, the symptoms appear about 5 to 7 days. So that is the basis of the certificate. And I think that answers your question. Huh? Then there is this question about leaders and politicians flouting the rules. You know, as a ministry, we provide advice and we put the rules in place, and then as a government, the government machinery needs to work to be able to ensure that those rules are observed, and any contravention of those rules should have consequences. So certainly we would also are not happy to see some of these things that we see being reported in the media. Remember that anybody who flouts these rules, he actually places himself or herself at risk, at a very high risk, because of, as I said, the speed and ease with which the virus is spread. So that you're placing yourself at risk, in addition to placing others at risk. And therefore, we're saying you must take personal responsibility, and you must make sure that you do not place either yourself or others at risk. Okay? As far as following up on who has broken a regulation and what should be done, I think that is now government machinery that will swing in and take the necessary action that is required. Emmanuel To, although when you came up here you said 2 CSEs tested negative. Negative? Huh? Okay, I thought positive. You know, I too heard from the grapevine like you. I don't know anything about it, let me be honest. I don't know. I don't know about any CSEs who were tested and who turned out positive. Honestly, I do not know. I don't know if my colleagues here know, but we don't know about that. There's a lot of stuff that is out there that circulates. We cannot verify that one. Now, then you also had a question about, someone had a question about Kiambu versus Mombasa. I have to tell you that the numbers we give here are numbers that once we go in and test in certain place, we pick out positives, those number of positives. If we really want to compare numbers between counties, then there must be a basis for comparison, which is, for example, I tested 100 people in Mombasa, I picked so many. I tested 100 in Kiambu, I picked so many. You can compare those numbers, isn't it? I think with our numbers, really, it's not a basis of comparison, because the samples that are collected follow certain paths, they are contact tracing and other things, so they may not necessarily be the same number of samples that you can, so you do not have a common denominator that you can compare them with. So, that is understood. Then you talked about underlying conditions. Indeed, underlying conditions are clearly a very high risk for this disease. Very high risk. We do know from our own data here that people who have underlying conditions have a higher chance of succumbing to the disease. And in terms of underlying diseases, I think if you have both hypertension, if you have two comorbidities, for example, hypertension and diabetes, the chances are high. If you have hypertension alone, that follows. Then if you have diabetes and so on. But comorbidities or an immune compromised situation is fertile ground for this virus to really finish one off. And that is why we say it is very important to protect our elderly people, because we know it's the elderly that will generally have these chronic diseases. We need really to protect them. And we need to ensure that we do not create situations where they can be able to contract the virus. Okay? Many of our elderly people are people who live out there in the rural areas. So we really need to protect them. And even as we have lifted the movement restrictions from Nairobi, which is a hot spot, Mombasa, those who are traveling back to their rural areas must remember that they could carry this disease and give it to their loved ones. And therefore, it's important that they minimize those interactions and observe all the measures that we have put in place. Thank you. Which 19 number? Yes, what was the question about the 19 deaths? What about the 19 deaths?
They were asking about the deaths, but I think that we can clarify. You know, this one is not being an issue. Because now they give you 19 and now they're saying it's 4.
The deaths, okay.
But you can say you will clarify.
Was it an error? The number of deaths is also an error. So let me clarify again, please. Sorry about this, but I am informed that the number, in fact, I was looking at the report, and I think the 19 number is wrong. It's an error. It is 4 deaths that were recorded today. 4 deaths. So I will take back all that stuff about this being the highest number of deaths, so on. Apology, but that is an error. Okay? And we will correct the document with those figures before we release it to you, so that you are able to communicate the right information to the public. Thank you. There are some that had, I looked at that earlier on, I can tell you, yes, there were 4 deaths. I'll tell you, these deaths occurred in Kenyatta University Teaching and Referral Hospital. There was a 72-year-old male from Nairobi who died. He had a condition, underlying condition of 3 conditions: hypertension, diabetes, and chronic kidney disease. First one. Then we had a second death in Nyanyuki Level 5 Hospital in Laikipia, a 51-year-old male, no underlying condition. The third death was at KNH in Nairobi, a 30-year-old female. And I want to stress to you too that age really does not protect you. Even young people can get and die from this disease. In fact, 2 of the last 2 deaths were both females, one 30, the other 39, at KNH and Aga Khan University respectively, and they had no underlying conditions. Okay? Thank you.